So, dear friends, I am having this 80-bed hospital at Pimpri near Pune, just 16 kilometers away from Pune, and treating all sorts of cases like severe cases, emergency cases, and acute emergencies, which we cannot see in the homeopathic treatment. So, there are various types of cases. Usually, if you would like to open the hospital, first thing is that you have to face the critical or severe emergency cases. If you are going to be success to tackle the severe cases, critical cases, then only you will be capable to run the hospital. So, it was my plan since my first year of admission to DHMS. And since that time, I was thinking there was a lot of criticism of homeopathy on that days also. But now today it is criticism spreading like rumor. No, everyone is trying to criticize homeopathy. Yesterday I had read one article in the DNA that homeopathy is a fake, homeopathy is a dummy science, it's a placebo science, like that. So a lot of things are going on, lot of things are happening in homeopathy, criticizing the peoples, and they would like to confuse our society. Even the British Journal of Homeopathy refuses that it is not a fake science, it's a philosophical science. It is having philosophical background. So, any science which is based on the philosophy is not a fake science. There are some principles, there are some laws which we are going to see, we are going to observe. But why these people are criticizing homeopathy? That is very interesting, because we, the homeopath, we are having lack of knowledge. We are not using homeopathy as a full strength. That is the problem. We are having colleges, we are having good lecturers, everything is there available in India. But unfortunately, in our colleges, just like the sir told you, there are dummy patients admitted, and we are not getting good cases to observe. We are not getting good cases to learn. That is the problem in entire world, not only in India, but I had seen in London, in Australia also. The same thing is happening. The people are not basically using the homeopathic principles, that is the single remedy and minimum doses. And London medical, in other countries medical colleges, I had seen the people are using Rustox at morning, sulfur at afternoon, and natramur at evening. I don't know why they are doing these things. These are the really very rubbish thing, and if you would like to evacuate all these things, homeopathy is a really beautiful and wonderful science. It is not a miraculous science, but it is science based on the fixed principles, philosophical background, which Dr. Hanuman taught about us. The base of the science is the vital force, and nobody knows what is the vital force. What is the function of vital force in our body? I had written one book on this vital force, a very interesting book, which was published at Poland, which was published by the Giant publisher, and which was published at Poland at a homeopathic conference there, and everybody likes that book very much, because it is a book which is mentioning what is exactly vital force. In that book, I would like to mention, I would like to compare the vital force with oxygen, because the vital force is nothing but it's a oxygen energy. And whenever there is a lack of oxygen condition occurs in your cellular mitochondria, then only the cellular dysfunctioning starts. And even the Nobel scientist, one of the Nobel scientists, he declared already the cancer cells also changes take place their behaving in the structure because of lack of oxygen. Lack of oxygen create DNA RNA changes and dysfunctioning in the cellular level. So, not only the cancer, but every type of diseases we can see there is a basic cause, that vital energy is deranged. Vital energy is deranged means what? The vital force means oxygen energy is already deranged. You can see in infarct also, in myocardial infarction, whenever there is blood supply is hampered, locked or blocked, at that time the patient dies due to lack of blood supply, lack of oxygen supply to the cardiac muscles. The same thing happens in every organs. The same thing happens in all the pathological conditions. You can see in every pathological condition there is a derangement of vital force, and whenever there is a good oxygen supply to the specific organ, specific tissue or specific cell, then only the rapid recovery will take place. Unless and until you are not having sufficient oxygen to the cellular level or the diseased organ level, then only the recovery will not take place. It is a very simple mathematics. So, our medicine works at that level. It stimulates the mitochondria. Once the mitochondria is gets stimulated, the cell starts its original functioning, the DNA RNA changes become normal, and the cell become healthy very easily, very rapidly. That is why, the lack of oxygen condition happens every time in our body. When we are thinking about something different like anxious mood, fear mood or any specific mood, at that time your respiratory changes occurs in your body. At that time, because of the respiratory changes, the body does not get adequate oxygen supply to the cellular level. So, every time, every emotion, every bad emotions or any bad thought create a disturbance in the respiratory system. Even in the fear, even in the anger, the respiratory rate is increasing. We are using our chest more probably, we are starting breathlessness, gasping like that, and even the adrenaline secretion and all the hormonal secretion increases that time, blood flow increases and tachycardia takes place. The tachycardia is a sign of lack of oxygen. So, just I am giving you some examples, and why these yogi peoples are stable in their life, because they doesn't have any grudge, they doesn't have any greed or like that, they doesn't have that much type of anger, sexuality, a lot of problems there. Their mind is so much cool, and because of that they are keeping pranayama, means breathing technique is there, which creates smoothly oxygen supply to entire system and entire cellular system and mitochondria and all the organs. So, you can see the yogi people are living 200 years, 300 years life and more and more and more. Why? Because there is no derangement. Even their skin is very bright, sunshine, very charming skin is there. Why? It shows the good oxygen supply. You can look at their eyes, you can see the very cheerful, very bright eyes are there. They are not sunken, they are not dehydrated, they are not weak eyes. You can get a good power from their eyes. From their face you can read these are very cheerful persons, very energetic persons. How this energy creating? Because they are having breathing control. And what our medicine does in the human being also, what I had done research on this vital force, and in that book I mentioned our medicine creates good stimulations to the mitochondria, to the cellular level, and the oxygen energy is, they try to equal the oxygen level energy everywhere in the disease or deformed organ, and the patient starts feeling well. Even you can see there are a lot of changes in